Good evening, students, colleagues, and friends. I am Dr. Okechukwu from Abia State University, and I'm here to talk about one of the abdominal organs called the pancreas. Today's date is 17/3/2020. For information, the pancreas is a composite organ. That means that it has both an exocrine function and an endocrine function. It has exocrine and endocrine function. It is situated posteriorly or posterior to the stomach, and it lies transversely from the duodenum. If we give this as the structure of the stomach, and this one as the structure of the duodenum, is situated in this location. That means, and here we have the spleen. Said it lies transversely from the duodenum on the right side down to the spleen on the left side. This one is the spleen, and this is the duodenum. While this is the stomach, and this is the representation of the pancreas over here. This is the pancreas. The pancreas is here, while this dot represents the pancreatic duct. So this is how the pancreas lies transversely. It starts from the duodenum down to the spleen. The pancreas is approximately 15 cm long, and it weighs around 80 grams. It has three parts. It has the head of the pancreas, it has the neck, or four parts, sorry. That's the head of pancreas, neck of pancreas, body of pancreas, and tail of pancreas. Then this pancreas has a lumpy nodular texture when you look at it, and is covered with a transparent connective tissue. The pancreas, as I said before, has two functions, exocrine and endocrine. Then if you look at the blood supply to the pancreas, it has principally three arteries that give its blood supply to the pancreas. It has the blood supply coming from the common hepatic artery. It also has the blood supply coming from the splenic artery, and it also has the blood supply from the superior mesenteric artery. So the splenic artery runs on the superior border of the pancreas, and it is the main arterial supply to the pancreas, which is called arteria pancreatica magna. We call it arteria pancreatica or pancreatico magna. Magma. So that is the major branch from the splenic artery. Then we now have the one coming from the common hepatic artery, which is a branch of the celiac trunk. It gives a branch to the head of the pancreas, which is called the superior pancreatico-duodenal artery. and another branch coming from the superior mesenteric, which is called the inferior pancreatico-duodenal artery. These two branches will form an anastomosis around the head of pancreas. So you now look at the venous drainage of the pancreas. The pancreas is actually drained by the splenic veins into the hepatic portal veins. So that is the venous drainage of the pancreas. Then we'll look at the exocrine part of the pancreas. For the exocrine part of the pancreas, we know that it collects through ducts, through smaller ducts, before it comes to larger ducts. So from the beginning of this duct is what we call the pancreatic acini. So we have the pancreatic acini. These pancreatic acini, they are actually compound tubuloacinar glands. So they release their secretion. They are actually composed of simple cuboidal epithelium. So their secretions are called the pancreatic juice. They go from this pancreatic acini level to smaller ducts, which finally come to this pancreatic duct, which is the major pancreatic duct that now carries this pancreatic juice down to the second part of duodenum here. So this part is what we refer to as the second part of duodenum. And this pancreatic duct, together with the duct coming from the liver and the gallbladder, which is called the bile duct, now empties into the second part of duodenum by forming an ampulla. And this ampulla is referred to as the duodenal ampulla, or we call it the duodenal papilla. But embryologically, the pancreas develops by two buds on the guts of the GIT. It has two pancreatic buds that will develop, one on the ventral side of the gut, while one on the ventral side, one on the dorsal side. So during rotation, on the 35th day of intrauterine life, the ventral bud will rotate and go posteriorly to finally find itself at this level. So this former ventral bud, pancreatic bud of the pancreas, this former ventral pancreatic bud will now rotate as a result of the rotation of the gut, and now come to align on the lower part of the dorsal pancreatic bud. So now the pancreatic duct from this dorsal pancreatic bud will now join with the one from the ventral to form the main pancreatic duct. So this main pancreatic duct, you now notice that there are two ducts. One is called the main. This is number one, which is continuation of from here. It goes down to become the main pancreatic duct, while you have another duct that goes the other way. So this main pancreatic duct is actually called the main pancreatic duct of Wilson. The man that actually found out this, the main pancreatic duct is called the pancreatic duct of Wilson. Then this other pancreatic duct that is actually going to the other part of the duodenum, which is called the duodenal papilla, is by another man that is referred to as Santorini. We call him Santorini. So that duct is called the accessory duct of Santorini. So you have the main pancreatic duct emptying into the duodenal ampulla, which is called the main pancreatic duct of Wilson, and another pancreatic duct which is accessory and also empties into the second part of duodenum, but in another papilla or ampulla, and it's called the accessory duct of Santorini. So these are the two ducts, or the two ducts where the exocrine part of pancreas empties. Then if you now come to the endocrine part of the pancreas, you have that the endocrine part of pancreas makes up just 1% of the number of cells in the pancreatic tissue. But surprisingly, you have the endocrine part of the pancreas, which we call the islets of Langerhans. These islets of Langerhans, you have the islets making up close to 2 million islets of Langerhans in the pancreatic tissue. And these islets of Langerhans have a lot of cells, groups of cells that make them up in these islets of Langerhans. You have the first group, which we call the alpha cells. We call them the alpha cells. And these alpha cells have their secretion. You now have the second group of cells, which we call the beta cells. They also have their secretion. And you have the third group of cells that we call the delta cells. They also have their secretion. And have the fourth group of cells, which we call the F cells. And they also have their secretion. If we now look at the first group of cells, you have the alpha cells. The alpha cells secrete what we call the glucagon. The glucagon is responsible for increasing the level of glucose in the blood, while the beta cells secrete the hormone, which we call insulin. Insulin ensures there is uptake of blood glucose from into these tissues of the body. Then you now have the delta cells. The delta cells secrete the hormone which we call somatostatin. The somatostatin are responsible for inhibiting the secretion of both glucagon and insulin. Then you now have the last group of cells, which we call the F cells. The F cells are responsible for the secretion of what is called pancreatic polypeptide hormones. So these are the principal secretions by the group of cells that are called the endocrine part of pancreas. The pancreas also has neural control, which is principally by the autonomic nervous system, and there are also regulations of the secretion of the pancreas by the duodenum. The duodenum secretes what is called the secretin, and the duodenum secretes another hormone called the cholecystokinins. And these hormones now help or ensures the secretion of pancreatic juices from the pancreas, from the exocrine part of pancreas. So far, that is the much I can give you on the lecture on pancreas. So if you have any question, you can ask me on this topic. Thank you so much. I remain Dr. Okechukwu. Thank you.